Introduction to asthma. Asthma is a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to recurrent episodes of wheezing, shortness of breath, chest tightness, and coughing. These symptoms often vary in intensity and frequency, sometimes worsening at night or in response to specific triggers. The condition affects millions worldwide, impacting daily activities and quality of life if not properly managed. Understanding the fundamental nature of asthma is the first step towards effective coping and management strategies. It is not a curable disease, but its symptoms are highly manageable with appropriate medical care and lifestyle adjustments. Early diagnosis and consistent treatment are crucial for preventing severe exacerbations and maintaining lung health over time. This course will delve into these aspects to provide a comprehensive overview. The inflammation associated with asthma makes the airways highly sensitive to various stimuli, causing them to constrict and produce excess mucus. This hypersensitivity is a hallmark of the disease, distinguishing it from other respiratory conditions. When an individual with asthma encounters a trigger, their airways react by tightening, making it difficult for air to pass through. This reaction can range from mild discomfort to a severe life-threatening asthma attack. Effective management aims to reduce this inflammation and sensitivity, thereby preventing symptoms and improving lung function. Learning to identify and avoid personal triggers is a cornerstone of living well with asthma. Prevalence and impact of asthma. Asthma is a global health concern, affecting an estimated 300 million people worldwide, with numbers continuing to rise, particularly in developing countries. Its prevalence varies significantly across different regions and demographics, often influenced by environmental factors, urbanization, and genetic predispositions. The disease is a leading cause of chronic illness among children, frequently resulting in school absenteeism and reduced participation in physical activities. Understanding these statistics helps to underscore the widespread impact of asthma on public health systems and individual lives. It is crucial to recognize that asthma is not just a minor inconvenience, but a serious condition that requires ongoing attention and resources. The economic burden of asthma, including healthcare costs and lost productivity, is substantial globally. The impact of asthma extends beyond physical symptoms, significantly affecting an individual's quality of life. Frequent symptoms, especially at night, can disrupt sleep, leading to fatigue and reduced concentration during the day. The unpredictable nature of asthma attacks can cause anxiety and fear, limiting participation in social events, sports, or even daily chores. Children with asthma may face social stigma or bullying, further impacting their emotional well-being. Effective management aims to minimize these impacts, allowing individuals to lead full and active lives. Addressing both the physical and psychological aspects of asthma is vital for holistic care and improved patient outcomes. Understanding asthma types. Asthma is not a single condition. It manifests in several forms, each with distinct characteristics and triggers. Allergic asthma, also known as extrinsic asthma, is the most common type, triggered by exposure to allergens like pollen, dust mites, pet dander, and mold. Non-allergic asthma, or intrinsic asthma, is not linked to allergens but can be triggered by factors such as stress, exercise, cold air, or infections. Understanding these distinctions is crucial for accurate diagnosis and tailored treatment plans. Some individuals may experience a combination of types, making personalized management essential. Identifying the specific type of asthma helps healthcare providers recommend the most effective preventative measures and medications. This differentiation also guides patients in recognizing their unique triggers. Exercise-induced bronchoconstriction, EIB, often referred to as exercise-induced asthma, occurs when physical activity causes the airways to narrow, leading to symptoms like coughing, wheezing, and shortness of breath. This type is particularly common in athletes and can be managed with pre-exercise medication. Occupational asthma is triggered by exposure to substances in the workplace, such as chemicals, dusts, or fumes, and typically improves when the individual is away from the trigger environment. Other less common types include nocturnal asthma, which worsens at night, and cough variant asthma, where a chronic cough is the primary symptom. Each type requires a specific approach to management and trigger avoidance. Common asthma symptoms. Recognizing the common symptoms of asthma is paramount for timely intervention and effective management. The most characteristic symptom is wheezing, a high-pitched whistling sound made while breathing, especially when exhaling, caused by narrowed airways. Another prevalent symptom is coughing, which can be dry or productive and often worsens at night or during exercise. Shortness of breath, or dyspnea, makes it feel difficult to get enough air, leading to a sensation of breathlessness. Chest tightness is a constricting feeling around the chest, often described as a pressure or squeezing sensation. These symptoms can appear suddenly or gradually, varying in severity from mild to life-threatening. Prompt identification allows for quick administration of reliever medications and prevents exacerbations. Understanding these signs helps individuals and caregivers respond appropriately. It is important to note that not all individuals with asthma experience all these symptoms, and their presentation can differ. For instance, some people, particularly children, may primarily experience a chronic cough without significant wheezing, known as cough variant asthma. The severity and frequency of symptoms can also fluctuate, influenced by triggers, time of day, and overall health. Monitoring these symptoms is a key component of an asthma action plan, guiding decisions on medication adjustments and when to seek medical attention. Regular self-assessment of symptoms helps in maintaining control over the condition. Being vigilant about changes in symptom patterns is crucial for managing asthma effectively. Common environmental triggers. Environmental triggers play a significant role in exacerbating asthma symptoms for many individuals. Pollen released by trees, grasses, and weeds is a common seasonal allergen that can cause severe reactions. Dust mites, microscopic creatures that thrive in warm, humid environments, are often found in bedding, carpets, and upholstered furniture. Pet dander, tiny flakes of skin shed by animals, particularly cats and dogs, can remain airborne for long periods and settle on surfaces. Mold, which grows in damp areas, releases spores that can trigger asthma symptoms when inhaled. Identifying and minimizing exposure to these common environmental triggers is a cornerstone of effective asthma management. Regular cleaning and allergen-proofing the home can significantly reduce symptom frequency. Understanding the specific triggers helps in creating a safer living environment. Strategies for managing environmental triggers involve a combination of avoidance and mitigation. For pollen, staying indoors during peak pollen counts, using air conditioning, and keeping windows closed can help. To combat dust mites, frequent washing of bedding in hot water, using allergen-proof covers, and vacuuming with a HEPA filter are recommended. For pet dander, limiting pets to certain areas, regular grooming, and using air purifiers can be beneficial. Though complete avoidance may be necessary for severe allergies, addressing mold requires fixing leaks, improving ventilation, and cleaning affected areas with mold-killing products. Implementing these measures can drastically improve asthma control and reduce the need for reliever medications. Irritants and air pollution. Beyond allergens, various irritants and forms of air pollution can significantly worsen asthma symptoms. Tobacco smoke, both direct and second-hand, is a potent irritant that causes inflammation and damage to the airways. Chemical fumes from cleaning products, paints, or industrial sources can also trigger severe asthma attacks. Strong odors from perfumes, air fresheners, or scented candles, though not allergens, can irritate sensitive airways. Outdoor air pollution, including ozone, particulate matter from vehicle exhaust, and industrial emissions, is a major contributor to asthma exacerbations, especially in urban areas. Minimizing exposure to these irritants is as crucial as allergen avoidance for effective asthma management. Awareness of these factors empowers individuals to make informed choices about their environment. Protecting respiratory health involves being mindful of both indoor and outdoor air quality. Strategies to reduce exposure to irritants and air pollution involve both personal actions and broader awareness. Avoiding smoking and ensuring smoke-free environments at home and work are fundamental. When using cleaning products or paints, ensuring adequate ventilation or opting for less irritating alternatives is advisable. Limiting the use of strong perfumes and scented products can also help. For outdoor air pollution, monitoring air quality reports and reducing outdoor activities on high pollution days is recommended. Using air purifiers with activated carbon filters can help remove gaseous irritants indoors. Advocating for cleaner air policies and supporting environmental initiatives also contributes to a healthier environment for everyone, especially those with asthma. Infections and emotional factors. Respiratory infections, such as the common cold, flu, and bronchitis, are frequent triggers for asthma exacerbations. These infections cause inflammation in the airways, making them more sensitive and prone to constriction. Even a mild cold can lead to significant asthma symptoms, requiring increased medication or even emergency care. Vaccination against influenza and pneumonia is highly recommended for individuals with asthma to reduce the risk of severe infections. Practicing good hand hygiene and avoiding close contact with sick individuals are also crucial preventative measures. Proactive management of infections is a key strategy in maintaining asthma control. It is important to consult a doctor at the first sign of a respiratory infection. Emotional factors, including stress, anxiety, and strong emotions like crying or laughing intensely, can also trigger or worsen asthma symptoms for some individuals. While not directly causing airway inflammation, these emotions can lead to changes in breathing patterns, such as hyperventilation, which can irritate the airways. Stress can also weaken the immune system, making individuals more susceptible to infections. Developing effective stress management techniques, such as mindfulness, meditation, or deep breathing exercises, can be beneficial. Recognizing the link between emotional state and asthma symptoms allows for a more holistic approach to management. Seeking support from mental health professionals can also be a valuable part of coping with asthma. Diagnostic procedures for asthma. Diagnosing asthma involves a comprehensive evaluation by a healthcare professional, typically starting with a detailed medical history. The doctor will inquire about symptoms, their frequency, severity, and any potential triggers, as well as family history of asthma or allergies. A physical examination will be conducted, focusing on the respiratory system. Though lung sounds may be normal between asthma attacks, these initial steps help to gather crucial information and rule out other conditions that might present with similar symptoms. Open and honest communication with your doctor about your experiences is vital for an accurate diagnosis. The diagnostic process is iterative, combining patient history with objective measurements to confirm the presence of asthma. This thorough approach ensures that the correct treatment path is chosen. Following the initial assessment, objective tests are performed to confirm the diagnosis and assess lung function. The primary diagnostic tool is spirometry, which measures how much air an individual can exhale and how quickly. Other tests may include peak flow monitoring, which measures the maximum speed of exhalation, and sometimes a methacholine challenge test to assess airway hyperresponsiveness. Allergy testing may also be conducted if allergic asthma is suspected. These tests provide quantifiable data that helps in confirming asthma, determining its severity, and monitoring treatment effectiveness. The combination of clinical assessment and lung function tests provides a clear picture for diagnosis. Spirometry explained. Spirometry is a crucial lung function test used to diagnose asthma and monitor its severity and response to treatment. During the test, an individual takes a deep breath and then exhales as hard and fast as possible into a device called a spirometer. The spirometer measures two key values: forced expiratory volume in 1 second, FEV1, which is the amount of air exhaled in the first second, and forced vital capacity, FVC, the total amount of air exhaled. These measurements are compared to normal values for a person of similar age, height, sex, and ethnicity. Reduced FEV1 and a low FEV1-FVC ratio are indicative of airway obstruction, a hallmark of asthma. The test is often performed before and after administering a bronchodilator to assess reversibility of airway obstruction, which further supports an asthma diagnosis. This objective data is invaluable for healthcare providers. The results of spirometry provide critical information for guiding asthma management. A significant improvement in FEV1 after bronchodilator use suggests reversible airway obstruction, a characteristic feature of asthma. Regular spirometry can help track the progression of the disease and the effectiveness of long-term controller medications. It also helps differentiate asthma from other chronic lung conditions like chronic obstructive pulmonary disease, COPD. Understanding spirometry results empowers patients to better comprehend their lung health and treatment efficacy. This test is non-invasive and generally well tolerated, making it a standard procedure in asthma care. Interpreting these results requires professional expertise. Peak flow monitoring. Peak flow monitoring is a simple yet effective tool for individuals with asthma to regularly assess their lung function at home. A peak flow meter is a small, portable device that measures peak expiratory flow, PEF, the maximum speed at which air can be exhaled from the lungs. By regularly recording PEF readings, individuals can track changes in their lung function, identify worsening asthma before symptoms become severe, and assess the effectiveness of their medications. Establishing a personal best peak flow reading when asthma is well controlled is crucial, as subsequent readings are compared against this benchmark. This daily monitoring provides objective data that complements symptom tracking. It empowers patients to take a more active role in managing their condition. Consistent use helps in early detection of potential asthma attacks. The peak flow meter is particularly useful for guiding decisions outlined in an asthma action plan. A drop in PEF readings, even without noticeable symptoms, can indicate narrowing airways and signal the need for increased medication or medical attention. The traffic light system, green, yellow, red zones, is often used to interpret peak flow readings, providing clear instructions on how to respond. Green zone indicates good control. Yellow zone suggests caution and potential need for reliever medication, and red zone signifies a medical emergency. Proper technique for using the peak flow meter is essential for accurate readings. Regular communication of peak flow trends with a healthcare provider helps optimize long-term asthma management. This tool is a cornerstone of self-management. Asthma severity classification. Asthma severity is classified to guide treatment decisions and ensure appropriate management for each individual. The classification is based on frequency and intensity of symptoms, lung function measurements like FEV1, and the need for reliever medications. The main categories include intermittent, mild persistent, moderate persistent, and severe persistent asthma. Intermittent asthma involves symptoms less than twice a week and infrequent nighttime symptoms, with normal lung function between exacerbations. This classification helps healthcare providers tailor treatment plans, ensuring that individuals receive the right level of care. Accurate assessment of severity is dynamic and may change over time, requiring regular reevaluation. It provides a framework for understanding the disease's impact. Mild persistent asthma is characterized by symptoms more than twice a week, but less than daily, with nighttime symptoms occurring 3 to 4 times a month. Moderate persistent asthma involves daily symptoms and nighttime symptoms more than once a week, often impacting activity. Severe persistent asthma entails continuous daily symptoms, frequent nighttime symptoms, and significant limitations on physical activity. These classifications are crucial for determining the step-up or step-down of medication therapy. For example, individuals with severe persistent asthma will typically require higher doses of controller medications and potentially additional therapies. Regular assessment of severity ensures that treatment remains optimized for achieving and maintaining asthma control. This systematic approach helps in achieving the best possible outcomes. Goals of asthma management. The primary goals of asthma management are multifaceted, aiming to achieve and maintain good symptom control, prevent exacerbations, and enable individuals to lead full, active lives. Good symptom control means experiencing minimal or no daily asthma symptoms, infrequent nighttime awakenings due to asthma, and rare need for reliever medications. This allows for normal physical activity and participation in work or school without limitations. Achieving these goals significantly improves an individual's quality of life and reduces the emotional burden of the disease. Effective management is a partnership between the patient and their healthcare team. It focuses on long-term well-being rather than just short-term relief. The ultimate aim is to minimize the impact of asthma on daily living. Preventing asthma exacerbations or asthma attacks is another critical goal, as these events can be severe, requiring emergency medical attention or hospitalization. Exacerbations can also lead to long-term lung damage if not properly managed. Management strategies focus on identifying and avoiding triggers, consistent use of controller medications, and prompt action when symptoms worsen. Another important goal is to minimize medication side effects, ensuring that the benefits of treatment outweigh any potential adverse reactions. Regular monitoring of lung function and symptoms, along with adherence to a personalized asthma action plan, are essential for achieving these comprehensive management goals. This holistic approach ensures both immediate relief and sustained health. Developing an asthma action plan. An asthma action plan is a personalized written guide developed in collaboration with a healthcare provider, outlining how to manage asthma on a daily basis and what to do during an asthma attack. It typically uses a traffic light system, green, yellow, red zones, based on symptoms or peak flow readings, to provide clear instructions. The green zone indicates good control, detailing daily controller medications. The yellow zone signals worsening asthma, providing instructions on increasing medication or adding reliever inhaler doses. The red zone outlines steps for severe symptoms or very low peak flow readings, indicating a medical emergency and when to seek urgent care. This plan empowers individuals to take control of their asthma and respond appropriately to changes in their condition. It is a vital tool for preventing severe exacerbations and ensuring timely medical attention. Every person with asthma should have a current and accessible action plan. Key components of an asthma action plan include a list of daily medications with dosages, instructions for using reliever medications, specific steps to take when symptoms worsen, and clear guidelines on when to contact a doctor or seek emergency medical care. It should also include contact information for the healthcare provider and emergency services. The plan should be reviewed and updated regularly with the healthcare team, especially after any changes in medication or asthma severity. Keeping the plan readily accessible, perhaps on a refrigerator or in a wallet, ensures it can be followed quickly during an emergency. Sharing the plan with family members, caregivers, and school or work personnel is also important for coordinated care. This proactive approach significantly improves asthma outcomes. Role of healthcare professionals. A multidisciplinary team of healthcare professionals plays a vital role in the effective management of asthma. Primary care physicians often provide initial diagnosis and ongoing management, prescribing medications and developing action plans. Pulmonologists, specialists in lung diseases, are consulted for complex or severe cases, offering advanced diagnostic and treatment options. Nurses and asthma educators provide crucial patient education, demonstrating proper inhaler techniques, reviewing action plans, and offering support for self-management. Their expertise ensures that patients understand their condition and how to manage it effectively. These professionals work collaboratively to provide comprehensive care. Building a strong relationship with your healthcare team is essential for long-term asthma control. They are key resources for information and guidance. Pharmacists are also integral to asthma care, providing essential information on medications, potential side effects, and proper storage. They can also offer advice on over-the-counter remedies and identify potential drug interactions. Allergists may be involved if allergic asthma is suspected, conducting allergy tests, and recommending specific allergen avoidance strategies or immunotherapy. Respiratory therapists can provide specialized training in breathing exercises and techniques to improve lung function. This collaborative approach ensures that all aspects of asthma care, from medication to lifestyle adjustments, are addressed. Each professional contributes unique expertise to optimize patient outcomes. Leveraging the full team ensures holistic and well-rounded management. Self-management strategies. Effective self-management is paramount for individuals living with asthma, empowering them to maintain control over their condition and prevent exacerbations. A key strategy is strict adherence to prescribed medication regimens, ensuring controller medications are taken daily as directed, even when feeling well. Regularly monitoring symptoms and peak flow readings provides objective data to track asthma control and identify early warning signs of worsening asthma. Avoiding known triggers, whether environmental allergens, irritants, or specific foods, is also crucial. These proactive steps significantly reduce the frequency and severity of asthma symptoms. Self-management is not just about reacting to symptoms, but about consistent, preventative care. It fosters a sense of empowerment and responsibility in managing one's health. Beyond medication and trigger avoidance, self-management encompasses lifestyle choices and preparedness. Maintaining a healthful weight through balanced nutrition and regular physical activity, as advised by a doctor, can improve lung function. Quitting smoking and avoiding secondhand smoke are non-negotiable for asthma sufferers. Being prepared for an asthma attack by always carrying reliever medication and having an updated asthma action plan readily accessible is vital. Educating family members, friends, and colleagues about your asthma and action plan ensures support during emergencies. Continuous learning about asthma and engaging with support groups can also enhance self-management skills. These comprehensive strategies contribute to a better quality of life and reduced reliance on emergency care. Controller medications are the cornerstone of long-term asthma management, designed to prevent symptoms and reduce the frequency and severity of asthma attacks. These medications are taken daily, even when symptoms are absent, to reduce airway inflammation and hypersensitivity. Inhaled corticosteroids, ICS, are the most effective controller medications, working by reducing swelling and mucus production in the airways. They are delivered directly to the lungs, minimizing systemic side effects. Examples include fluticasone, budesonide, and mometasone. Consistent use of ICS is crucial for maintaining asthma control and preventing irreversible lung damage. It is important to understand that these medications do not provide immediate relief, but work over time. Adherence to the prescribed regimen is vital for their efficacy. Another important class of controller medications includes long-acting beta agonists, LABAs, which relax the muscles around the airways, keeping them open for an extended period. LABAs are never used alone for asthma, but are typically combined with an ICS in a single inhaler for enhanced efficacy. Examples of combination inhalers include fluticasone, salmeterol, and budesonide formoterol. Leukotriene modifiers, such as montelukast, are oral medications that block the action of leukotrienes, chemicals that cause inflammation and airway constriction. These are often used as an add-on therapy, particularly for allergic asthma or exercise-induced bronchoconstriction. Understanding the purpose and proper use of each controller medication is essential for effective asthma management. They are foundational to preventing symptoms and improving lung function. Reliever medications, also known as rescue inhalers, are fast-acting bronchodilators used to quickly open airways and alleviate acute asthma symptoms during an asthma attack. These medications work by relaxing the smooth muscles around the airways, providing rapid relief from wheezing, shortness of breath, and chest tightness. Short-acting beta agonists, SABAs, such as albuterol, salbutamol, are the most common type of reliever medication. They typically take effect within minutes, and their effects last for several hours. Reliever inhalers should be carried at all times by individuals with asthma, as they are essential for managing sudden symptom flare-ups. It is crucial to understand that these medications treat symptoms but do not address the underlying inflammation. Over-reliance on reliever medications can indicate poorly controlled asthma. While essential for immediate symptom relief, frequent use of reliever medications, more than twice a week, not including pre-exercise use, is a strong indicator that asthma is not well controlled and that controller medication regimen may need adjustment. This signals a need to consult a healthcare provider to review the asthma action plan and potentially step up controller therapy. Misuse or overuse of reliever inhalers can also lead to decreased effectiveness over time and potential side effects like tremors or increased heart rate. Proper technique for using reliever inhalers is just as important as for controller inhalers to ensure the medication reaches the lungs effectively. Understanding the role of reliever medications as a rescue tool, not a daily preventative, is key to effective asthma management. Proper inhaler techniques. Correct inhaler technique is critical for ensuring that asthma medications reach the lungs effectively, maximizing their therapeutic benefits. Incorrect technique is a common reason for poor asthma control, even when prescribed the right medications. For metered dose inhalers, MDIs, the technique involves shaking the inhaler, breathing out fully, placing the mouthpiece in the mouth, pressing down on the canister while slowly inhaling deeply, holding the breath for 10 seconds and then exhaling slowly. Using a spacer device with an MDI is highly recommended, especially for children and those with difficulty coordinating breath and actuation, as it improves medication delivery to the lungs and reduces side effects. Spacers help ensure more medication reaches the airways and less settles in the mouth and throat. Proper instruction and demonstration are essentials for patients. Dry powder inhalers, DPIs, require a different technique, typically involving a quick, deep inhalation to draw the medication into the lungs. The specific steps vary slightly depending on the DPI device, so it is crucial to follow the manufacturer's instructions and receive training from a healthcare professional. After using any inhaled corticosteroid, rinsing the mouth with water and spitting it out is important to prevent oral thrush and other local side effects. Regular review of inhaler technique with a doctor, nurse, or pharmacist is recommended to ensure continued proficiency. Mastering the correct technique empowers individuals to get the most out of their asthma medications, leading to better symptom control and reduced exacerbations. This small effort yields significant health benefits. Oral medications and biologics. Beyond inhaled therapies, oral medications and biologics offer additional treatment options for individuals with asthma, particularly those with more severe or difficult to control disease. Oral corticosteroids, such as prednisone, are powerful anti-inflammatory drugs used for short periods to treat severe asthma exacerbations or as a long-term option for very severe persistent asthma. However, due to significant systemic side effects with prolonged use, they are generally reserved for when other treatments are insufficient. Leukotriene modifiers, like montelukast, are oral tablets that reduce inflammation and relax airways, often used as an add-on therapy for mild to moderate persistent asthma, especially for allergic or exercise-induced asthma. These medications provide systemic effects, influencing the entire body. Understanding their specific roles is crucial for appropriate use. Biologic therapies represent a newer class of medications that target specific inflammatory pathways involved in severe asthma. These are typically administered via injection, subcutaneous or intravenous, and are reserved for individuals with severe asthma that remains uncontrolled despite optimal use of inhaled corticosteroids and other controller medications. Examples include omalizumab, anti-IgE, mepolizumab, and reslizumab, anti-IL-5, and dupilumab, anti-IL-4/IL-13. Biologics work by blocking specific immune cells or proteins that contribute to asthma inflammation, thereby reducing symptoms and exacerbations. They are highly specialized treatments, often requiring careful patient selection and administration by a healthcare professional. These advanced therapies offer hope for those with severe, refractory asthma, significantly improving their quality of life. They represent a significant advancement in personalized asthma care. Lifestyle adjustments for asthma. Making specific lifestyle adjustments can significantly contribute to better asthma control and overall well-being. Regular physical activity, when managed appropriately, can strengthen lung function and improve cardiovascular health. It's important to work with a healthcare provider to develop an exercise plan that minimizes exercise-induced bronchoconstriction, often involving pre-exercise reliever medication. Maintaining a healthy weight through a balanced diet and regular exercise can also reduce asthma symptoms, as obesity is linked to more severe asthma. Avoiding smoking, both active and passive, is perhaps the most critical lifestyle change, as tobacco smoke severely irritates airways and worsens inflammation. These adjustments are not just about managing symptoms, but about fostering a healthier body that is more resilient to asthma. They empower individuals to take an active role in their health. Diet and nutrition also play a role in asthma management. While no specific asthma diet exists, a diet rich in fruits, vegetables, and whole grains, similar to a Mediterranean diet, can provide anti-inflammatory benefits. Some individuals may find certain food allergens or sensitivities trigger their asthma, requiring dietary modifications. It is important to identify and avoid such triggers under medical guidance. Ensuring adequate vitamin D intake has also been linked to improved asthma control for some. Limiting processed foods and sugary drinks can contribute to overall health and potentially reduce inflammation. These dietary considerations, combined with regular exercise and avoiding smoke, form a comprehensive approach to managing asthma through lifestyle. A holistic approach supports better respiratory health. Stress management techniques. Stress and anxiety can significantly impact asthma control, often triggering or worsening symptoms. Implementing effective stress management techniques is therefore a crucial component of comprehensive asthma care. Deep breathing exercises, such as diaphragmatic breathing, can help regulate breathing patterns, reduce hyperventilation, and promote relaxation. Mindfulness meditation involves focusing on the present moment and observing thoughts and sensations without judgment, which can reduce overall stress levels. Regular practice of these techniques can improve lung function and reduce the body's physiological response to stress. Learning to identify personal stresses and developing coping mechanisms is a proactive step. These practices offer a non-pharmacological approach to improving respiratory health. They provide tools for emotional regulation. Other beneficial stress management techniques include yoga and tai chi, which combine physical postures, breathing exercises, and meditation to promote relaxation and flexibility. Engaging in hobbies and activities that bring joy and distraction can also help alleviate stress. Ensuring adequate sleep is vital, as sleep deprivation can exacerbate stress and asthma symptoms. Seeking support from friends, family, or support groups provides an outlet for emotional expression and reduces feelings of isolation. For persistent or severe anxiety, consulting a mental health professional for counseling or therapy can be highly beneficial. Integrating these techniques into daily life can lead to improved emotional well-being and better asthma control, fostering a more resilient state of mind and body. Breathing exercises for asthma. Specific breathing exercises can be highly beneficial for individuals with asthma, helping to improve lung function, reduce shortness of breath, and manage anxiety during symptom flare-ups. Diaphragmatic breathing, also known as belly breathing, focuses on using the diaphragm rather than shallow chest breaths, which can be more efficient and less taxing on the respiratory muscles. This technique involves inhaling slowly through the nose, allowing the abdomen to rise, and exhaling slowly through pursed lips, feeling the abdomen fall. Regular practice strengthens the diaphragm and promotes deeper, more relaxed breathing. It can also help clear mucus from the airways. Learning and practicing these exercises can provide a sense of control and reduce panic during an asthma attack. They are a valuable addition to an asthma management plan. Pursed-lip breathing is another effective technique that helps to slow down breathing, keep airways open longer, and improve oxygen exchange. This involves inhaling slowly through the nose for a count of 2, then exhaling slowly through pursed lips, as if whistling, for a count of 4 or more. This technique creates a slight back pressure in the airways, preventing them from collapsing too quickly and allowing more air to escape. Both diaphragmatic and pursed lip breathing can be practiced daily to improve respiratory efficiency and can be particularly useful during periods of increased breathlessness. Consulting a respiratory therapist or asthma educator can provide personalized guidance and ensure correct technique. These exercises are complementary to medication and trigger avoidance.